Before we go into the specific challenges faced by PAs and PA employers, we're going to look at what grief is and explore the different types of grief that exist.
Understanding different types of grief. Grief is a complex and deeply personal process encompassing various forms that reflect the diverse ways people experience and express loss. I will explore several types of grief, their characteristics, and how they may impact individuals. Anticipatory grief. This arises before a loss occurs, often in situation involving a terminally ill loved one. It's a natural response to the expectation of loss, and while deeply painful, can also provide an opportunity for emotional preparation. Those experiencing anticipatory grief may feel a mix of emotions, including sadness, anger, guilt, and even relief. These feelings are valid as individuals grapple with the impending loss and its implications. This type of grief can also foster meaningful moments of connection and closure, allowing time to express love, create memories, or say goodbye. Complicated grief. Also known as prolonged grief disorder, complicated grief is more intense and enduring than typical grief, often interfering with daily functioning. Unlike normal grief, which tends to ease over time, complicated grief may feel like an unrelenting cycle of pain and longing that persists for months or even years. Certain type of losses, such as the death of a child, a life partner, or in traumatic circumstances like suicide, are more likely to result in complicated grief. There are professional assessment tools to help identify this type of grief, enabling individuals to seek specialized support. Therapy is often essential in helping people navigate these overwhelming emotions. Inhibited grief. This occurs when individuals suppress or avoid their emotions rather than expressing them. Over time, this suppression can manifest in physical symptoms like fatigue, headaches, or digestive issues, as well as mental health challenges such as anxiety and depression. People experiencing inhibited grief may not realize they are holding back their feelings. This could stem from cultural expectations, a lack of support, or uncertainty about how to process the loss. Recognizing and addressing uninhibited grief can be transformative, allowing individuals to release suppressed emotion and begin to heal. There are other types of grief, as grief comes in many forms, each shaped by the nature of the loss and individual circumstances. In addition to the ones I have already mentioned here, there is also acute grief, which is the immediate and intense response to a loss, often marked by shock, disbelief, or overwhelming sadness. This typically occurs in the days or weeks following a death or a significant event. Normal grief, a common type of grief involving a natural progression of emotions such as sadness, anger, and acceptance. Whilst there is no normal way to grieve, this term refers to the process where feelings gradually ease over time without becoming debilitating. Disenfranchised grief. This is grief that arises from the loss, not socially acknowledged or supported, such as the death of a partner or a pet, for example. But this could also apply to your employer if you're a PA. This lack of recognition can make grieving more challenging as the focus may be on the family, for example, and not on you. And so this can make it feel like a very isolating experience, and you may feel invalidated. Traumatic grief occurs after a sudden, violent, or shocking loss, such as a natural disaster or fatal accident. The trauma can complicate grieving, leading to symptoms like flashbacks or heightened anxiety. Preparatory grief, similar to anticipatory grief, focuses on the person who is dying. It involves emotionally preparing for the end of life and coming to terms with the reality of the situation. Cumulative grief happens when somebody experiences multiple losses in a short period of time. The weight of successive losses can be overwhelming, making it difficult to process any one grief fully. Collective grief, shared by a community or a group in response to a major event, can often foster solidarity and sharing in mourning. This can be applied to a team of PAs working together.
Grief can manifest itself in many ways, such as emotionally, physically, or behaviourally. Helen Rutherford explains.
So we're now going to focus on the emotional, physical, and behavioural domains so that we can see how you can be affected. Emotional responses may include sadness, anger, guilt, denial, and anxiety. You may also experience loneliness or a deep yearning for the deceased. Physical symptoms may include fatigue, sleep disturbances, appetite changes, headaches, or gastrointestinal issues. You may experience having a weakened immune system, making you more prone to illness. Behavioral changes you may notice in yourself may include you may become more socially withdrawn or avoidant of reminders of the deceased. You may notice that you have increased substance use or you've disrupted daily routines. I think it's really important to recognize that grief is not a linear process and it does not follow a set path or timeline. There's a lot to be considered. There are cultural influences, traditions, and norms that can shape how grief is experienced. Sometimes we have expectations of what grief should look like. So if you need support, seek it when needed. It can be invaluable because grief sometimes can be overwhelming.
There are a number of misconceptions about the grieving process. Helen Rutherford unwraps some of these for us.
Grief is universal, yet uniquely experienced. Despite this, myths about the grieving process persist. Here are some common misconceptions which I've come across. So, a myth would be there is a right way to grieve. In reality, grief manifests itself differently for everyone. Some people cry, others may seek solitude, and some might prefer to stay busy. There is no correct way to grieve, and what feels right can vary from moment to moment. Another myth is grief should resolve after a certain period of time. In reality, grief has no set timeline. While it often lessens with time, significant losses can leave a lasting impact. Intensity may fluctuate, especially around anniversaries or holidays or even stressful life events. Another myth is that grief follows a distinct stage. In reality, this idea of distinct stages is a helpful framework for some, but research has shown that grief does not follow a linear path. It's a dynamic process, and stages may not apply to everyone. You can also move back and forward amongst the stages. Another myth is grief is just sadness. In reality, grief encompasses a wide range of emotions, including anger, guilt, jealousy, and even joy or gratitude. These emotions may fluctuate or coexist in complex ways. Another myth is giving advice is the best way to help someone who is grieving. In reality, while well intentioned, advice can sometimes feel impersonal or judgmental. Often, the most valuable support is simply being present, showing that you care, and listening without judgment.
There are a number of recommended techniques that can help someone who is affected by grief. Helen Rutherford lists some of them for us.
Now I am going to take you through some effective techniques for grief support that are used in therapy. Therapists play a crucial role in helping individuals to navigate their grief. Some effective strategies may include creating a safe space, encouraging clients to share memories and talk about their loved ones. You can ask them about the deceased's personality, likes, dislikes, and even their flaws. This can help validate the client's experience and honor the life of the person they have lost. Distinguishing grief from trauma. This helps clients separate the natural process of grief from traumatic responses, such as intrusive images or flashbacks. Trauma can impede the process of grief, so addressing it directly is essential. Using metaphors. Using analogies can help clients reframe their loss. For example, comparing the end of life to the final punctuation in a book reminds them of the story that is shared, the memories that remain. The chapters are all there. A person is the whole story, not just the full stop. Addressing guilt. Many clients feel guilty about the things they did or didn't do and not grieving enough. So, reassuring them that living well honors the loved one's memory. Encourage restorative practices such as setting aside specific times to grieve. Promote rituals and structure. Suggest to clients and dedicate specific days to remember their loved one. This organized approach can help contain grief, preventing it from becoming overwhelming whilst fostering meaningful remembrance. Encourage forward thinking. As the healing begins, it's important to support the client in envisaging a fulfilling future.
We will now move on to the perspective of an employer who's gone through the process of losing someone. Charlie Walker shares her story.
It was hard to share with the team when we got the news he was entering palliative care. I tried my hardest to support the PAs. I tried really hard to offer them emotional support. We did make suggestions that they talk to their GPs about dealing with the emotional response. Unfortunately, the GPs kind of said it's your job, just get over it. So that was quite challenging in itself, trying to get a hold of any sort of therapy for them. Because they didn't just need it after he was gone, you needed it during it because it was such a difficult thing juggling me and him. I naturally was getting sick on and off, as I do anyway. So juggling the two of us at times when we were both poorly was even just the strain on the team was really, really hard. And I tried my hardest to offer them support, offer them to someone to talk to. And I really focused on their needs. I tried to arrange a lot of fun activities to do and make a lot of memories. We tried to do a lot of things where we took photos, and we also started our team is called Charlie's Angels, and it was then too. And we made a Charlie's Angels scrapbook, and all of our fun things we've done with him during the palliative care phase, and that it all went in this one book. And then we all wrote something about each activity, and it was just a way that we could remember the good times during the hard times, but then also once he was gone, we had something real special to keep. Also, my team leader was his mum. So that was really helpful having her as well. They could talk to, because I know sometimes they held back a bit with me because I didn't want to add more onto my job load. So basically, we just all became a little unit, and we were just all fighting to get through, and almost what it felt like war, just to get through to the end and give him his best quality life as we could. And we all just sort of came together because there wasn't a lot of help, except from the employment insurance. They gave a lot of help. There was no boundaries in this situation. There was no professional boundaries we could set, especially once it got closer and closer to the end. At the beginning of palliative care, it was just about the start of when things become unmanageable. And so as we progressed, it was a 2-year in palliative care was 2 years, until he passed. I mean, we've always had a friendly relationship with our PAs because they're in every moment of our lives. I mean, some of the PAs on the team, they were with us when he proposed to me. So, like, they've seen everything. And there was just no way you could keep personal boundaries, at least for us. And we did become one big family trying to support each other. And, you know, like my PAs would try and talk to their loved ones when they were off shift at home, but their loved ones didn't know who Paul was. So they didn't know exactly. They could empathize, but they didn't know. Whereas all of us, me, mum, the girls, we were all in it. We all knew exactly what we were all going through. So we just became one massive unit with no boundaries whatsoever. And we all just done whatever we could. If one of us was struggling, then the girls, I'd buy the girls some chocolate. You know, we bought them flowers. And periodically, we'd buy, me and Paul would buy them flowers just to say thank you for their hard work, because they really went above and beyond, because we weren't getting the support we needed from the, you know, local authority and things. So we just became each other's support system and a little family. We felt really, really unsupported. I especially did. I tried to shield a lot from Paul because he was going through enough. He didn't really need all that. But there was no help with the fact that we had a high turnover. And that turnover was because they weren't getting the rate of pay they should. And it was too much workload for one person. We had a little bit of hours where it was a crossover where we had a couple of girls on, but that wasn't all the time, and it needed to be. So it was, what I needed from my local authority was for them to come in, increase the rate of pay to match the skill set, because the team were learning new things medically all the time to care for him. You know, their skills were growing, so we should have had an extra funding for that. We also should have had 2 people with us 24/7, because I was palliative care and I was going through loads of surgeries and things as well during that spell. So it was really, really dangerous of them to leave us like that. And their excuse was, well, care agencies and do loads of people in one day, and care homes have more than one patient per, they don't have one-to-one. And I'm like, I know, but this isn't that situation, is it? So I really wanted them to offer some help. I also think that they should have been more understanding, because they felt we should have kept professional boundaries, and they felt that the PAs were getting too involved and that I was getting too emotionally invested in them, when I needed them to understand that a human being was passing away. You needed that comfort. The girls were with us 24/7. They were all doing extra shifts free of charge, you know, so they could help us out when they could. And they went above and beyond. And I just feel the local authority was just absolutely diabolical. And then how they dealt with things after his passing just made it even worse. We had wonderful support from our insurance. To be honest, our insurance probably offered more than what insurance normally would. But they suggested we do, when the GP said no to therapy, they suggested self-referrals, that I should do one, my mum and my team. They also suggested that I go to an advocate when we were fighting for extra care. And indeed, once he passed, when I was fighting to have the package back. And then they just offered so much support during the whole process of palliative care and redundancy. They kept letting me know what I was entitled to. They also let me know things that aren't necessarily an employer's insurance things. I know I got suggested a charity that one of them had used for bereavement, and they recommended a charity and things. So they did go above and beyond, and it didn't matter if I spoke to different people at the insurance. They all knew what was going on, and they were all so kind and caring. So I absolutely value my employer's insurance. They were wonderful.
We will now hear the thoughts of Ross Hovey, who's been a PA employer for many years, about the difficulty in preparing for palliative care, especially at a young age.
I don't know if you could ever prepare that conversation and that situation. I don't know, and it's not something I think any of us want to prepare for either. But the nature of a PA and employer relationship means that potentially at some time during someone's time with you, that's going to happen. And for people with, neuromuscular conditions like muscular dystrophy and SMA, there is a higher chance that that's going. I mean, that it's going to happen one day. You just hope that it's as long as far away as possible. So I don't feel prepared, no, but I think I don't feel unprepared because equally the type of relationship that I have as people get to know you, work with you, you talk very openly that there is a risk of a greater chance of potential death. But I don't think anyone is particularly prepared for the D word. As a person, on a very personal level, I have two fears in life: thunder and death. So I avoid that conversation, and it does feel like quite uncomfortable to approach it. And I think also, like nobody wants to think about their time ending. And I think people with muscular dystrophy, people with Duchenne's, people with SMA, we probably have a little piece in the back of our brain that says, well, I was told at a young age I wouldn't live this long, and I'm now gone past that. Like, oh, when does the time bomb go off? And so you don't really want to think about it. You just want to enjoy your life while you're here. So yeah, what I would do if I knew that situation was on the horizon and wasn't sudden, I think I would start to put building blocks in place. So, for example, I would reach out to my PHB provider and understand if there's any form of like counselling that could be available, or someone that they could speak to, like someone that they could, I can't think of the word, but like, is there someone that they could seek counsel during the period? If my family were around still, I would also ask for them to be available to speak. I would think about maybe, not reduce hours, but trying to get people to have more support at work in terms of the hours. And I think I'd also start doing things like more practical things, like making sure that I'd written a reference for them. So that, should they want to continue in this field of work when I'm not here, that there's a glowing reference for them. Obviously, so I really do think it's important that PA employers do prepare for this. And I don't know when you start, because everyone's situation is unique. I guess one of my concerns is that there's two elements. There's the emotional side of it and the practical side. I'll deal with the practical side first. I think, like this role is so unique that if you're not using an agent to do your payroll and your timesheets and you're doing it all yourself, who's going to do all that? So I think the first thing I'd prepare is that they know where all this information is and how to transact that and make sure that happens, or maybe appoint somebody, maybe one of your main carers, longest standing one, to be able to take over that and show where it is, and maybe and using your smartphones and things nowadays, you can leave legacy passwords to people. So setting that up, maybe speaking to a friend, a really close friend, and saying as well, like, I'm just going to share you this stuff because if something happens to me, I need to make sure these people get their final pay and things like that. Having some references stored in a Dropbox folder, maybe ready should the time, again, giving them access to that as and when the time is right, and write it in a way that says, if you're receiving this reference, it's at a time when I'm no longer here to be able to provide a written response, so they're proactively going to give you it. I think from an emotional point of view, it is important, because you need to be ready to, as much as you might be going through things yourself, you need to support them. And at the end of the day, you still need to receive any care during that time, and you need that to be as still safe and reliable as you possibly can. So I think it is really important to proactively prepare for that, and maybe also have a document maybe that says, what would you want to happen in this situation as well, that share. So I think some kind of unfortunately, the time has come plan in a box somewhere ready to be able to pull upon when you need it.
are a number of challenges that PAs can face when caring for someone who is at the palliative stage, both during and after their passing.
The hard thing we experienced was more than just the physical toll of the increased care needs and being on full-time ventilation. He was also very angry and would lash out at his PAs verbally. He became very hard to please. Nothing we did was good enough. We understood that, as he didn't want to pass away young, leaving his wife and pets, his family, but he closed off and wouldn't talk to anyone. He withdrew from life, essentially. That was the hardest thing.
My PAs always said to me, the hard thing about juggling it isn't doing the tasks. Like, some of them were quite messy tasks, and they said we could do the messiest of tasks all the time. Their hardest thing that they struggled with was seeing such a lovely, kind person be so low. And they also said seeing someone young, he was 39 when he passed. He was 37 when he started palliative care. They were so sad to see someone young pass. And they also said they were really sad knowing that I was being a widow at 27. That really hurt them. So I think it was more the emotional thing of how his mental health was dealing with it, which they understood. Don't get me wrong, they totally understood. But that was what they really struggled with, was to see someone so happy be so sad.
I imagine as a team we would need a lot of further training, and her needs would increase during the palliative care phase. I would hope our increased skill set would be acknowledged and we would receive higher wages from her funding body, but to be honest, I doubt they would. My employer lost her husband and he needed care as well. She has shared a little of what they went through, so I don't hold out hope of the same funding body would do any better for her, to be honest. She would fight for us, though, for as long as she could.
I think we can agree there are specific challenges faced by personal assistants when dealing with grief and loss. You face unique challenges when coping with this grief in this role, given the professional yet deeply personal relationship you will share with your employer. So, what are the key challenges to this? As I said earlier, you may experience disenfranchised grief, so society may overlook your grief, focusing on the employer's family, and this is invalidating, and so it's important that you get the right support for you too. Also, another consideration is identity shift. Losing an employer disrupts daily routines and can leave the PA struggling to redefine their role and purpose, because it's not often you lose your job at the same day as you may lose a friend. So there are practical concerns. The sudden loss of employment often brings financial strain alongside the emotional impact. So it's important that you look after your mental health when dealing with this. Balancing boundaries. The close bond with an employer can make it difficult to grieve while maintaining professional boundaries. I would recommend seeking validation, connecting with carers and other professional networks and other PAs so that you don't feel that you're alone. Also, if you're able to, plan ahead. Discuss potential transitions with your employer if possible, as this is something that they might think of too. You can also obviously access personal counselling if you feel that's like the right thing to do. I think it's important to have a space to be able to process your feelings and your experiences, because this is uniquely your experience. It may be useful to save for the future to try and cushion that financial burden when the worst happens.
Before and after the passing of a PA employer can be a really emotionally challenging time, so it's really important that you look after and care for yourself.
If your employer is in the palliative stage, you can prepare for their passing. At this stage, you have an important but difficult role to play. There are a lot of different elements to it. It's important to provide both practical and emotional support to your employer whilst also preparing yourself for their eventual passing. Knowing in advance that you are going to lose your employer comes with many challenges, but also it's an opportunity to be present and listen, an opportunity to spend time with them, even if it's simply sitting quietly or holding their hand. Let them express their thoughts and feelings without fear of judgment. This could be really valuable to them. Respect their wishes. Honor their preferences regarding their end of life care, communication, and other decisions. You may need to advocate for the person. Adapt your interactions to align with their needs and priorities. This is pivotal in supporting them holistically at this point. You can offer practical support, assisting with daily tasks such as errands, meal preparation, or household chores to erase their burden. You could also provide support to their family and friends where appropriate. If, however, you don't feel that you are up to this, it's important that maybe you're aware of where that support could be found. Share memories and stories. Reminisce about positive experiences to bring comfort and joy at this time. Acknowledge your emotions. It's normal to feel sad, anger, or even guilt. Allow yourself to process these emotions. You can seek some support from families and friends and colleagues. If you'd like to, you can also seek help from professionals. Communicate openly at this time. Talk about your feelings and let them know it's okay to discuss death and dying if they wish to do so. If you do want some professional support at this time, you could consider joining a support group for carers or consulting with a therapist to manage the emotional challenges at this stage. Your role is challenging at this time, and it's okay to ask for help. It's also useful to think about what to avoid when having discussions at this time. It's useful not to offer false reassurances, such as everything will be okay, as this may be unhelpful to them. Don't push conversations about the future or make over-optimistic promises. It's important to allow them to let them take the lead, respect their boundaries, and don't force discussions they're not ready for. It's also really important to look after yourself throughout this process. Caring for someone in palliative care or dealing with the loss of an employer can be physically and emotionally draining, so self-care is essential. Take care of your physical health. Eat well, rest, and get fresh air whenever possible. Be kind to yourself, allow space to grieve, and acknowledge your emotions. Stay connected. Share your feelings with trusted friends or family. You may wish to express yourself creatively if you don't feel like talking. You can write or draw or engage in activities that help you process how you're feeling at that time. Accept help when offered. Allow others to support you too. You can honour the individual's legacy. You could organise a tribute or a fundraiser in their memory. Sometimes people just want to feel like they're doing something. You could support the family by creating a book of memories or contributing to a cause close to your employer's heart. By approaching these challenging situations with empathy and self awareness, PAs can honour their employer's memory while navigating their own grief with dignity and care. The sudden death of an employer is a deeply impactful event, both emotionally and professionally. For personal assistants, this experience often blurs the lines between work and personal grief. as the bond with their employer can be both close and unique. I will guide you through some practical steps and emotional support strategies to help navigate this challenging time. The first thing I would suggest is simple. Acknowledge the loss. Inform colleagues, family members, and others connected to the employer. Express your sorrow and recognize the profound effect this loss may have on everyone involved. You could offer support to others. Be available to share memories and listen to others who were close to the employer. Recognize that people process grief differently. Some may wish to talk immediately, while others may need some time. You could address your workplace adjustments. Accept that work routines are going to be disrupted. Assist in organising practical matters such as ensuring continuity of care of the employer's dependents or household if applicable. You can honour the employer's memory, participate in or help organise memorial activities such as a service, a memory board, or perhaps a book of memories. Consider gestures such as planting a tree or contributing to a charitable cause in their honour.
We will now hear about what improvements the individuals we interviewed would like to see when it comes to support for dealing with palliative care and the death of a PA employer.
I think employers should be supported by the funding bodies to have a redundancy plan in place, and this should be shared with PAs by their employer. I think they need supporting as it's a very difficult topic for an employer to manage on their own. Let's face it, who wants to discuss their own death? If funding bodies cannot do this, then employment insurance should be able to create a policy on palliative care and bereavement of an employer. They could also update this whenever laws or policies set by the government change as well. Again, I would like to see rules and policies in place during palliative care so that we are ready for that phase of care. I hope our pay would increase during the palliative care phase, as we would be increasing our skills and knowledge, as well as recognising what we have gone through in our redundancy package. I also think it is vital that insurances are created that cover our living expenses during our job hunt and once the redundancy payments run out. There must be an acknowledgement for the living costs we will need to cover during our job search once our employer has passed.
So whether your funding is provided by adult social care or the NHS through a personal health budget, both of those organisations are huge. So your local council is part of the UK Gov system, and the PHP is part of the NHS. They have like medical stuff, they have training and development, they will have an employee assistance program because of the very nature of their organisation. So I think it would be really useful to look at leveraging some of those services to people who use carers and employ them. If we're given the tools to manage, we're being asked to manage our own carers and take away the admin and all the agency stuff, give us the tools to do our job. So, make it a worthwhile career. So give them employee assistance program, give them some sick pay, give them access to a blue light card, make them feel valued, but also like the real serious one. This here is I don't think it should be on our. I don't think we should take all the brunt in an end of life situation of actually coping with it. I think that's where the funding provider should step in and offer additional support and focus on helping that person end their life in the most dignified way possible with the right people around them. And also, the other thing I'd like to say is if either of us dropped dead tomorrow, heaven forbid, actually, that person that's worked for you for 5 years, 10 years, they've still got a mortgage to pay. They haven't been made redundant. It's unfair. So actually, what provision to, giving them 3 months' pay to make sure that they're okay don't send them into a crisis situation without a job, and that kind of thing. I think that's another really important element of this. Like, it's almost like, what's the end of life payment procedure for them? And what if I hadn't written a reference in advance? You know, if it shows that they supported Ross Hovey for 10 years, at least the PHB could provide and say, we don't know how well they cared for each other, but the fact that they were employed 10 years for one of our service users, you know, would suggest that they were a good employee.
We will now hear from professionals about their perspectives on the topic. We'll first hear from the perspective of a direct payment support provider.
So my name's Teresa Cottrell and I'm the Specialist Advisor at Wessel. So PAs will be faced with maybe not getting their final wages, and including redundancy and any unused holiday. There may not always be enough funding to cover the final wages. The example I've got at the moment is that she's worked with, it's her mum, for 19 years. So you can imagine how big the redundancy will be for that. So we would usually make a claim to the insurance company and then request the local authority to top up the account, which can be a bit tricky, especially in the current climate. Payment is often delayed, which is challenging. This will affect the PA as they have bills to pay. The PA can become angry at Wessel for not being able to pay not being paid their final wages and finalise the payment. So this also has a knock-on effect because the PA may have an issue trying to claim benefits, especially if they've not received their P45. And then another challenge is the thought of finding alternative work and will they get another job? And there's the grief of losing that person that they've worked with for so long, especially if it's a family member.
We'll now hear from the perspective of an employer insurance provider who will talk about the legal aspects of entering palliative care and what steps need to be taken when a PA employer passes away.
So my name is Leona. I am the Business Development Manager for Mark Bates Limited. We are the specialist insurance living provider, and it's my role to ensure all of our products and services reflect the needs of our customers. And I do this by working closely alongside local authorities, ICBs, support providers all across the UK. So we offer employers' liability. There's different levels of cover, standard, plus and deluxe. And there is an extra level of cover called the healthcare cover, which comes with the deluxe level of cover. So that policy in itself was built alongside NHS England and their delegation process. So it's considered best practice. That's how it would be looked upon. It's not a legal requirement in any way, but certainly if your PA is undertaking healthcare activities, you would want potentially that extra level of cover. So if the employer sadly passes away, the role for the PA is no longer available. And if the PA has served more than 2 years, they may be entitled to redundancy and, of course, notice pay. It's important to handle this process really carefully in a legal manner, and you must notify the insurer, like I say, as soon as reasonably possible. So all of our insurance policies come with free 24-hour legal advice. That team is called ILG Support, and they will help you with the whole process. So from start to end, they'll guide you through every step. They'll also support whether it's a redundancy situation and any calculations if the PA is entitled to any. Sure. So step one is always to call us. It's really important to get that logged on your file. That's the situation that's happened. Our team are super helpful. They're very understanding, and they'll navigate you to where you need to be. So once you've spoke to us, the insurers, then they'll pass you over to the legal team, and then they'll discuss your next steps. Once you have that in order, you may be able to make a claim for PA's redundancy and notice pay through the policy itself. You may also assume that you no longer require the policy if somebody's passed away. You actually need it now more than ever, so it's important not to just go ahead and automatically cancel the policy, it's important to say. It's just reiterating, please don't be afraid to reach out. We're here to support you. We'll help as much as what we can do, and our team are equipped to support you wherever necessary. Even if you feel like you're in the wrong place, we can signpost you to the right places. If you are an employer who would like to provide extra support to your PAs, our sister company, Independent Living Group, have a service called ILGPA. It's an employee assistance program where your PAs can have an ID badge, access to a counselling service, legal advice service, health and wellbeing platform, personal financial or debt management. There's an app that you can have all about mindfulness and awareness. There's a rewards and discount platform as well. You can access cinema tickets, discounted high street shopping vouchers, restaurants and such. And also, I'm pleased to say, a blue light card you can access, or you can apply for a blue light card once you have ILGPA membership. So it's just something worth being aware of.